6 weeks of aerobic exercise can relieve the pain typically experienced by patients with fibromyalgia. Hi, this is Alexander, Minnesota chiropractor, Dr. David Butler. If you or someone you know suffers from fibromyalgia, you're going to be very interested in this video blog. This study comes from a December 2011 study which followed 9 women with fibromyalgia who discontinued analgesic medications, and according to the findings from the imaging studies reported during the Neuroscience 2011 conference, which was a Society for Neurosciences annual meeting, the aerobic exercise program not only decreased the pain and symptoms of fibromyalgia, but it also improved the participants' working memory. This finding, the researchers suggest, is a result of the increased activation of task-related parts of the brain, as shown by functional magnetic resonance imaging, or fMRI. The data, according to the research team leader Manish Katawad from Georgetown University Medical Center in Washington, D.C., quote, "These results are suggestive of the effect of exercise on not only self-reporting of global change in pain sensation in fibromyalgia, but also improvement in the network of cortical areas recruited in working memory." And he continues stating that exercise may benefit both reducing fibromyalgia symptoms and improving cognitive capacity. This study took place under the direction of John Van Meter, PhD, Director of Georgetown University's Center for Functional and Molecular Imaging. And the researchers studied 9 women with fibromyalgia. 8 had right-handed, 1 was left-handed, and their approximate age was about 45.8 years. The women were seen 4 times for evaluation, 1 at baseline, where they were receiving current fibromyalgia medications. 2 was called washout, where all the fibromyalgia medications were gone for 3 half-lives. And 3 after no treatment, 6 weeks after stopping fibromyalgia medication and starting the exercise program, and then after 6-week-long aerobic exercise intervention. And at each visit, the participants completed what was called an end-back functional MRI, working memory task. The researchers compared and analyzed changes in neuronal activity across visits based on changes in their patient global impression of change. An analysis of this change across the visits revealed increased activation in several task-related areas of the brain. And according to the senior author, Brian Willett, MD, who is the director of the University Fibromyalgia Evaluation and Research Center, quote, "This study demonstrates how these symptoms change with treatment and withdrawal of treatment, and what neurological correlations of these changes are." He goes on to say, "In conditions similar to fibromyalgia, the body perceives something by mistake. Unlike psychosomatic pain, the pain of fibromyalgia is now objectively verifiable and is probably produced by the central nervous system." In this study, the researcher team used functional MRI to provide a definitive measure of cognitive functioning so that we can more scientifically measure the effect of exercise. And according to the authors, this is a novel approach of the study of fibromyalgia. The researchers concluded, quote, "Our results indicate that as the patients discontinued their current medication treatment and transition into the exercise treatment, their subjective rating of change in pain initially increases and then decreases, and neuronal activity in areas recruited for the end-back functional MRI working memory task follow, an inverse pattern with an initial drop following medication cessation that increases on subsequent visits," means it improves over time. And if you'd like to read more about this study and the specific areas of the brain referenced in this study, it's kind of complicated, but please follow the link at the bottom of this video. Now, I got to say, I found this study very interesting. 29 years ago, when I first started in practice, the condition fibromyalgia wasn't even recognized. They called it fatigue syndrome. Patients were often told they had depression, or even worse, that their problems were all psychological, meaning they were all in their head, because the doctors couldn't find anything physically wrong with the patients when they examined them. So over the years, we've seen and helped a lot of fibromyalgia patients because they knew there was something causing their chronic pain, and they weren't satisfied with the typical diagnosis that it's all in their head and the treatment that pursued from that. So for many, our use of corrective chiropractic care along with exercise and diet recommendations have helped them get through the daily chronic debilitating pain that's known as fibromyalgia. So that also goes to show how the autonomic nervous system is stimulated by adjusting the thoracic spine and why it helps that. So if you want to know more about fibromyalgia, please check this article out, especially if you have family members. And if you want to talk to us, talk to 320-762-0667 for a no-charge consultation. See if we can help you. And if you're interested in learning more about health and wellness for your family, please visit backfeelsgreat.com. This is Dr. David Butler wishing you good health.